According to statistics from the National Institute on Aging, NIA, up to 68% of men over the age of 60 continue to engage in self-care related to their personal vitality. However, what's concerning is that most of them are unaware of whether this habit may be quietly affecting their aging hormones, prostate health, or overall vitality. Some keep it a secret out of embarrassment, while others quietly worry but don't know who to ask. In reality, this is one of the least talked about topics, yet it has a profound impact on emotional well-being, hormonal function, and overall quality of life. Today's video will help you better understand the scientific benefits of maintaining this habit in a healthy way, while also identifying common mistakes that may be harming your prostate. Hormonal balance and urinary system. This is not a taboo topic. This is a form of self-respect and self-care. If you are over 60, please watch this video to the end. It might change how you care for your health every single day. Which country are you watching from? Feel free to leave a comment below. Aging is inevitable, but a decline in vitality does not mean your body has lost its ability to recover. In fact, after turning 60, many men begin to notice clear changes in their aging hormones, such as fatigue, poor sleep, decreased enthusiasm for life, and a growing sense of disconnect with their own body. At the root of these changes is a drop in natural hormone levels, which play a key role in maintaining physical vitality. Memory, biological rhythms, and blood circulation in the pelvic region. Unlike earlier stages of life, everything tends to slow down at this age. The prostate becomes more prone to inflammation. The urinary system becomes more sensitive, and the body's ability to repair muscle tissue, blood vessels, and nerves is no longer as quick or efficient as before. That is why taking active steps to support male vitality after 60 becomes an essential part of a healthy lifestyle. The good news is that even though your natural hormones may be declining, your body can still respond very well when supported the right way. Gaining a clear understanding of these changes and adjusting your daily habits can help protect hormone function, maintain steady vitality, support a healthy urinary system, and renew your overall sense of well-being. This is the first step to regaining control and confidence in your own body. That's why understanding the true benefits of maintaining healthy personal habits can give you more confidence in listening to and taking care of your own body. Now, let's explore 10 scientifically proven benefits that make this practice a positive part of aging well. 1. Supports pelvic blood circulation. One of the most important factors in maintaining vitality after 60 is ensuring good blood flow to the pelvic region. When blood circulates regularly to the soft tissues and related organs, it helps preserve their elasticity and function. Gentle and mindful self-care can act like a form of light exercise, helping blood vessels stay flexible and responsive. This not only improves physical sensation, but also supports metabolism and tissue oxygenation, which are fundamental for overall health. Better circulation also means more stable blood pressure, a stronger heart, and a brain that receives enough nutrients to stay sharp. 2. Protects the prostate. The prostate is one of the most vulnerable organs in older men. After age 60, the risk of enlargement or inflammation increases significantly. Several major studies from Harvard University have shown that maintaining a healthy and balanced personal care routine may help reduce the buildup of fluids and toxins in the prostate. This can lower the risk of inflammation and abnormal changes. It's considered a natural way to support prostate function without medication. However, it is essential to understand your body's limits. Avoid excessive frequency or force. Make choices based on how your body truly feels. 3. Strengthens the pelvic floor muscles. Few people realize that during moments of emotional release, the pelvic floor muscles, especially the pubococcygeus muscle, are naturally activated. These muscles help control urination, stabilize the pelvic region, and support the function of related organs. In older men, as muscles weaken with age and reduced physical activity, naturally exercising the pelvic floor through proper self-care is a gentle yet effective way to strengthen this area. This can improve bladder control, reduce leakage when coughing or lifting, and enhance pelvic endurance. It also helps support posture and spinal stability. 4. Reduces stress and stabilizes blood pressure. Numerous studies show that after a moment of personal relief, the body releases endorphins and significantly lowers cortisol levels, the hormone responsible for stress. This is a natural restorative response that calms the nervous system. For older adults, this is especially beneficial, as elevated cortisol is linked to blood pressure fluctuations, sleep disturbances, and adrenal fatigue. Calming the nervous response can reduce strain on the heart and lead to a more stable heart rate. What matters most is that this activity is done with a relaxed mind, without rushing, as a way to help the body unwind and release the invisible stress that often comes with aging. 5. Strengthens the sense of connection with your body. After age 60, many people begin to feel distant from their own bodies. Changes in hormones, skin, and joints can lead to discouragement and the sense that things are going downhill. But in reality, proper self-care can help you reconnect with yourself. When you take time to be with your body, observe how it feels, and pay attention to even the smallest signals, you may realize that you're not as old as you thought. In fact, feeling physically connected can lift your mood, help you sleep better, and give more meaning to each day. As a result, you'll naturally take better care of your health, appreciate your body more, and listen to yourself with greater awareness every day. Helps detect physical changes early. When you regularly engage with your body, you're more likely to notice small changes such as mild swelling, unusual lumps, discomfort when touched, or changes in skin color. These could be early signs of issues like urinary tract inflammation, tissue fibrosis, or, in more serious cases, the beginning of benign or malignant growths. Being proactive in observing your body allows for early detection before problems worsen, increasing the chances of successful treatment without major interventions. No medication or device can replace this awareness because you are the one who knows your body best. 7. Improves sleep quality. Many older adults have trouble falling into deep sleep or wake up multiple times during the night due to hormonal imbalance or underlying anxiety. One natural way to improve sleep is to allow the body to release oxytocin, prolactin, and other calming hormones after gentle relief. These neurotransmitters act like natural sedatives, slowing the heart rate, calming the nerves, and helping you fall into deeper, more restful sleep. What's special is that you don't need sleeping pills or external therapies, just a quiet moment to let your body breathe and truly relax. 8. Supports urinary circulation. Gentle self-care not only improves blood flow to the pelvic region, but also positively affects the bladder, urethra, and the sphincter muscles that control urination. When blood is pumped regularly to this area, the tissues maintain their elasticity and contract more effectively. This helps reduce common issues such as urinary retention, leakage, or incomplete emptying of the bladder, frequent concerns among older men. In addition, feeling smooth and strong in this area contributes to greater confidence and a sense of control in daily life, so you no longer have to worry about awkward moments while traveling or attending social gatherings. 9. Keeps the brain and hormonal system engaged. Few people realize that the brain is the body's largest vitality organ. When you maintain the habit of imagining, connecting with positive emotions, and activating sensory signals, you're essentially exercising the part of your brain responsible for desire, bonding, and focus. This activity helps prevent neural degeneration, keeps the male hormone-regulating areas of the brain stable, and supports your overall well-being, including memory and thinking ability. The key isn't intensity, but rather a gentle, consistent rhythm, done with awareness as a way to keep your mind lively and engaged. 10. Trains the body's natural sense of control. One rarely discussed benefit of self-care is its ability to help you understand and manage your body's responses more effectively. Through techniques like pausing or pacing, you can train yourself to recognize your own limit point and learn to regulate more smoothly in real-life situations. This is a valuable skill that helps maintain composure and reduces anxiety when the body reacts unpredictably. Most importantly, it reminds you that your body still has the ability to adapt and recover as long as you remain patient and stay connected with it day by day. Despite the clear benefits, there are still subtle mistakes that many people overlook. If done incorrectly or without paying attention to your body, these seemingly small actions can have a significant impact on the health of your prostate, hormones, and urinary system. Let's explore 10 common mistakes and gentle solutions to help you stay balanced and safe. 2. Isolating yourself and withdrawing from social life. Some people over 60 tend to retreat into their own world, using personal care as their only form of comfort when feeling tired, lonely, or misunderstood. Over time, this can lead to disconnection from family, friends, and the community. What began as a helpful habit may become a source of isolation. The solution isn't to stop altogether, but to make this practice one part of a well-rounded life alongside conversation. Physical activity, spending time with children or grandchildren, and enjoying the outdoors to keep your spirit open and connected. 2. Being too forceful or using the wrong method, causing skin irritation. As we age, the sensitive skin in certain areas becomes thinner and more prone to irritation or minor inflammation. Being too rough or using a dry approach can cause redness, irritation, and even increase the risk of minor infections. If you've ever felt a stinging or burning sensation afterward, it's a sign to make adjustments. Always be gentle and patient, if needed. Use a natural, skin-safe moisturizer. Don't ignore small reactions your body is signaling that a boundary has been crossed. 3. Repeating one pattern until you lose sensitivity. The human body, especially the nervous system, remembers and adapts to repeated stimulation. If you always use the same touch, position, or rhythm for a long time, your brain may program itself to respond only to that pattern. As a result, it becomes harder for your body to react in different environments. The fix is simple. Occasionally change your rhythm, posture, or even just take deeper breaths and focus on full-body awareness. Refreshing the routine doesn't take away the habit. It actually brings more presence and enjoyment to each experience. Torah. Ignoring warning signs of hormonal or circulatory decline. Some people don't realize that if you can only feel physically responsive when alone, but lose all sensation during normal daily life, it may be a sign of declining hormone levels or poor blood circulation. Don't treat this as normal aging. In some cases, it's an early sign of high blood pressure, diabetes, or hormonal imbalance. Pay close attention to frequency, sensation, and how well your body responds. If these issues persist for more than 2 weeks, do not hesitate to see a urology or endocrinology specialist for proper guidance. Poor posture that compresses pelvic nerves. Older men often sit for long periods or bend forward too much during personal care, especially on hard or low chairs. This can compress a nerve in the pelvic region called the pudendal nerve. If compressed for too long, it may cause numbness, tingling, or dull pain below the hips. A simple way to prevent this is to lie down or semi-recline instead of sitting upright. Avoid prolonged sitting, and use a soft pillow to support the lower back. If numbness becomes persistent, it's best to consult a spine or neurology specialist. 6. Using it as the only outlet for negative emotions. Many people over 60 face emotional challenges such as retirement, children moving away, or the loss of a loved one. In these times, personal care can sometimes become a way to soothe loneliness, stress, or sadness. However, if it becomes the only method of emotional escape, dependence may develop. Remember, mental health needs a variety of tools: gentle exercise, meditation, listening to music, gardening, or simply talking to someone you trust can be equally powerful ways to restore emotional balance. 7. Carrying guilt or shame due to old beliefs. Some older adults grew up in environments where discussions about personal vitality were considered inappropriate. As a result, they may carry lingering guilt, shame, or anxiety whenever they think about self-care. But from a modern medical perspective, this is a natural physiological response of the body. There is nothing wrong with it when done mindfully and in moderation. If these old beliefs still feel heavy, you might consider speaking with a mental health counselor or simply confiding in someone you trust to help release those feelings. 8. Overdoing, leading to fatigue or pelvic discomfort, while the body has a strong ability to recover. Engaging in personal activity too frequently, several times a day for multiple days, can overwork the pelvic region. This may cause heaviness, mild pressure in the lower abdomen, or testicular area. These symptoms often reflect mild blood pooling or temporary soft tissue inflammation. Don't worry too much. Rest, drink plenty of water, and avoid repeating the activity for a few days. Listening to your body is the best way to know when to pause and when to continue. 9. Lower sperm quality. When trying to conceive, although rare, some men over 60 still hope to have children. In this case, it's important to know that frequent personal activity may temporarily reduce sperm quality, especially in terms of count and mobility. According to experts in the American Journal of Reproductive Medicine, if you are planning to conceive, it's best to space out personal care every 2 to 5 days for optimal quality. Also, make sure your diet includes enough zinc, vitamin E, and omega-3 and avoid staying up late to support better physical recovery. 10. Relying on imaginary content. Leading to emotional imbalance today. Images from online sources can be highly stimulating, but they often do not reflect the reality of emotional intimacy. If you rely entirely on this kind of content for sensation, you may develop unrealistic expectations and gradually lose emotional connection with your partner or even with yourself. To restore balance, try using imagination based on real-life memories, genuine emotions, or simply focus on your breath and whole-body awareness. This approach can help you rebuild a lasting harmony between your physical and emotional well-being. When done properly, self-care in later life can bring many health benefits. However, there are certain signs that should not be overlooked, as they may be the body's way of sending a warning. One of the most common signs is a prolonged drop in vitality, along with difficulty concentrating, poor sleep, and fatigue even without heavy activity. These are often signs of hormonal imbalance or declining male hormones due to aging. Additionally, if you experience difficulty urinating, frequent nighttime urination, or a mild burning or aching sensation in the urinary area, it could be an early sign of prostate enlargement or low-grade inflammation. These are common conditions among men over 60, but they should not be ignored if left untreated. They may affect your urinary function and lower your quality of life. In some cases, you may notice that your body no longer responds the way it used to, or that sensations begin to fade even after making adjustments. If these symptoms persist for more than 2 weeks, the sincere advice is to consult a urologist or hormone specialist. An early checkup helps detect and address the issue before it becomes more serious and harder to reverse. When reaching the age of 60, many people believe they must simply accept the changes in their body as something natural. But the truth is, your body still has the ability to recover if you know how to listen and care for it properly. Maintaining a gentle, balanced, and informed self-care routine is not only a natural behavior, it is also a way of showing care for your hormones, prostate, and overall physical and emotional health. As you've seen in this video, when done correctly, your body knows how to regulate itself, keeping your vitality and urinary function steady. But if done the wrong way, the consequences can quietly build over time, gradually affecting your quality of life without you even realizing it until it's too late. Starting today, all it takes is one small change: choosing the right posture, adjusting your routine to a reasonable rhythm, and paying closer attention to how your body feels each day. With just these simple steps, you can take back control of your health in a positive and lasting way. If you found this video helpful, don't forget to share it with a loved one or subscribe to the channel so you won't miss upcoming content. Are you experiencing something similar? Feel free to leave a comment below. I always read each and every message from you.